Health is one of the main assets for any individual. The performance of the individual or the outcome of the society all depends upon the living conditions of individual members or particular community or particular society. The well-being and healthy conditions are very crucial for any social conditions. So in this presentation, we are going to discuss about how an individual can utilize the media and information system to retrieve required health information, accessing the health information, understanding the information in a very appropriate way, and converting the understanding into behavior. So this is a basic health communication perspective, but we are looking at the health communication from the media literacy perspective. Media literacy perspective, health communication means how media and information can be utilized for the well-being of an individual. And in that connection, the Sustainable Development Goal number 3 talking about the well-being of the human living conditions of all the age groups. We will take more details in the presentation. We are all familiar with the 3 terms: media, health and literacy. Independently, it gives appropriate meaning to us, like media, health and literacy. We have seen a lot of discussion in the first 4 weeks of this course about media role in the society and media audience and media policies. And we had one specific week on media and information literacy. So we have seen separately about media and in literacy. And health is quite common and quite familiar with every one of us. If you take it independently, it gives appropriate meaning. What is the meaning of health? What is the meaning of media? And what is the meaning of literacy? But when we combine all the 3 into one concept called media and health information literacy or media health literacy, it becomes a complex process. Media and communication system is an omnipresent element in our daily lives. That quite are familiar with the first 4 weeks lectures and text we have covered extensively on the media and communication system. And it's one of the main sources of information for all of us. This media system is a rich source of information on health matters for all types of media users. Not necessarily politics, not necessarily crime or celebrity or entertainment news. Health too, very important information required for every one of us. The World Health Organization has identified that media provides a platform for critical health literacy messages. Not only the traditional mainstream media, even the latest internet-based online medium also provide significant health information. It is for the individual users to identify the correct information from the reliable sources and interpret the information in a rightful manner, or the crucial competencies and skills required for the individual in order to get the maximum benefit from those information. So that's the crux of the media literacy concept: competency and skills to access, to understand and to participate in the communication system. We will usually discuss the media literacy in a very generic form of all types of media and information content. But here we are applying those 3 main competency and skills in the health context. And the prevention is a better form of treatment, because before getting the disease or before getting health hazards, and it's always advised to prevent the individual from the health consequences. In order to make ourselves immune or make ourselves prevent from any health infections, we should have adequate knowledge, we should have adequate awareness about a good number of health consequences, health situations. This awareness, knowledge comes from information, comes from multiple sources. Of course, health professionals are the main sources of in the health infrastructure. They are the one competent enough, trained enough, provide treatment and other medical support services. But the health information provides awareness and knowledge that helps large chunks of individuals to get infected. So prevention is a better cure. So in that context, information and communication system plays a very crucial role, and for individuals they need to have competency and skills to operate, handle, understand and participate in the communication system. That is the media literacy. Better the media literacy skill in the health communication context, the person's living conditions much better compared to the person doesn't have that much ability, access to the information and media system. We will come to the role of media in the health communication process. We have understood the context and the role of information communication in individuals' health scenario. Now, in generally, what is the role of media in the social context, particularly in the context of health communication? Multiple agencies regularly conduct campaigns on health issues, government and public sector or international agencies. One of the tools used for these campaigns is through the dissemination of information through various media outlets. Media and communication system helps the health agencies to reach out to the individuals and intermediary groups. The intermediary groups are the grassroots level community health workers such as Anganwadi workers and ASHA workers. Primarily, the society-wide communication system helps to reach the target audience directly as well as through community health workers. Vaccination is one of the example in the Indian context. We have a success story for eradicating polio through vaccination and awareness campaigns. Through media and health information, the communication system plays three important roles. It intervenes, it supports, it educates. We will take up these three components individually in a brief manner. Everyone may be aware that the prevention is a very important process in the health intervention. In the process, media and information system disseminate health messages to wider audience in order to educate the potential targets against any harmful infections. Eventually, it supports the overall campaign strategies. The media system, in order to take the information to the wider audience, it supports the campaigns. It intervenes the social process, it supports the health infrastructures, and it educates the mass audience. With a limited health infrastructure, the media's role is very crucial in our social conditions. We will come to that media and information literacy briefly because we have studied extensively in the week number 3. Basically, media and information literacy denotes multiple literacy components. Particularly, it is a combination of information literacy and media literacy. Mainly focuses on skills to retrieve relevant information effectively and ability to understand those information for better interpretation and the knowledge growth. Particularly in the era of information revolution, it's more important to have these competency and skills of media literacy. We are currently amidst the pandemic affected situation, like a corona and COVID-19, the last 4-5 months. It got changed the whole life and whole living conditions, the social process across the world, across the global level. Every one of us is concerned about many aspects of health issues, particularly in this pandemic situation, which resulted in a massive dissemination of health information about corona, about COVID-19 over the internet, over the social media, and over all the mainstream media. This is one of the dominating media content across the media platform, be it radio, television, newspaper or online. And we are bombarded with the information about the pandemic. The crucial role is of any individual is to select and verify those information about health conditions. It's very, very crucial before accepting that information. That is one of the criteria to select information and understand the information and accepting and utilizing it for our personal usage. Health is a state of well-being of individuals and society. If individuals are in good health conditions, then that indicates the status of that particular society. However, as per UN data, that's the 2019 data, less than half of the global population is being covered by the health services. Half of them are not in with the purview of health conditions, health are not under the health infrastructure. They are not able to get the infrastructure benefits, half of the global population. In this context, maintaining healthy conditions, healthy living or promoting well-being of all ages is the main targets of Sustainable Development Goal number 3. There are many targets under the goal number 3, particularly about reducing mortality rates in the various sections like child death rates, maternal mortality rate, deaths from non-communicable diseases and reducing road accidents, enhancing the capacity of health workforces and many more are the targets of goal number 3. But all this needs to be achieved before 2030. That's a broad deadline for all the 17 goals of Sustainable Development Goals. All these targets and goals are broadly termed as a public health practices. Public health practices aimed towards better healthy society and prolonging life expectancy and reducing disease burden. So that's a broad aim and vision of any public health strategies. And media and information also plays a crucial role in this public health practices, particularly in Indian context, where 74% of literacy rate is prevailing. This is 2011 census data. The majority of the population lives in the rural areas where the health infrastructure is not adequate. In this scenario, the role of media and intermediary community health workers and ability of individuals to retrieve health information are very crucial for the betterment of public health practices. Health communication is not a new concept, and the role of media in the health communication, we have seen that there are three major roles: intervention, supporting the health campaign and educating the mass. But these three primary roles of media in the health context started from the day one the printing technology was introduced. And initially the printing technology, as you are aware, that it was limited to the books and very rudimentary magazines. And one of the classic example of role of early printing technology for health campaigns, it is dated back to 1721 Boston smallpox epidemic case. The religious and political leaders had extensively used pamphlets to educate the people on the smallpox epidemic. In the 19th century, newspaper columns, by the time 19th century, the printing technology got developed much sophisticated. The newspaper got a proper shape and started a regular frequency and started communicating wider audience. So in the 19th century, the majority of the focus of mainstream media, particularly that period, is a newspaper only. They were used, the newspaper columns were used extensively for educating alcoholic reforms. In the early part, we have seen that pamphlets used for controlling the epidemic. In the 19th century, the newspapers were used for alcoholic reforms. In the 20th century, we had witnessed introduction of technology-based media operations like radio and television. Newspaper went through modernization of its printing operation. Through electronic media, major efforts were made to attempt to change the behavioral patterns of common people. Many public service announcements were targeted towards risk behavior of people in order to protect themselves from hazardous health consequences. That was the early understanding, early efforts of radio and television to change the behavioral pattern. Behavioral pattern is a crucial part in any health communication campaign strategies. So that was targeted in that level. And in the recent development with of internet and ICT tools and modernized satellite communication and sophisticated color printing and technology and all, the health communication process of mainstream media we can classify into two broad categories. You will find plenty of health information in all these media platforms, but those information can be classified into two categories. One is in the positive side, one is the negative side. The positive side is about health promoting messages. The negative side is about health compromising messages. Easily you can classify any sort of information available in the public domain through media platform can be classified either health promoting messages or health compromising messages. Health compromising messages are mainly focused on any behavior that deteriorates healthy conditions of an individual, such as smoking, alcoholism and drug abuse. And there are content either in the entertainment forums, entertainment conditions or surrogate advertisements or implicit messages that denotes or promotes health compromising messages. You might have noticed these kind of scenarios either in the films or the serials or in any other media platform. However, in Indian context as well as in elsewhere, through proper and stringent regulatory body system, nowadays the health compromising messages are controlled extensively. Direct advertisements that promote cigarettes and alcohols are not allowed in Indian media. Even in the films, statutory warning needs to be displayed whenever there is a scene depicting health compromising contents. On the other hand, there are a positive side of the health communication, that's health promoting messages, which specifically deals with prevention of health hazards, educating common people against health consequences, and intervention in support of the health campaigns by the media in order to reach out to the wider audience. So you will find two different way of approach by the media. One is a commercial level. Majority of the health compromising messages, earlier it was mainly commercials and in the entertainment format. But health promoting messages are mainly done by government agencies or health professionals or the newspaper or media itself in order to reach out to the mass audience on certain health conditions. Health promoting messages are created with a purpose and with the intention to create a behavioral changes among the target population. More importantly, health campaigns keen to observe the end results of media messages. Health compromising messages, health promoting messages, both are intended to change the certain behavioral changes. But the positive side is more important than the negative side, because negative side there is a lot of efforts has been taken to minimize the quantum of health compromising messages. The focus mainly on the positive side of that, educating the mass with the health information. Either government agencies or health professionals or the campaign groups, they are more keen to understand the end result of health promoting messages. What happens when the individual receives the messages and what happened after understanding the messages, whether any changes has happened over the period of time or not. So that's a very crucial part of our presentation on the media information, media and health literacy part. Health information cannot be clubbed with other media contents like politics, crime and sports. Access to unreliable information, dubious sources, misunderstanding, wrong interpretation are sometimes fatal for the media audience, in the particularly reference to health information. If the health information is not comes from the reliable sources, even comes from the reliable sources, if not properly decoded, not properly understood the core content of the health information that created trouble, unlike the other information. Other politics and crime or entertainment, international news, that's maximum changes your perception and opinion. But here our practices, our health conditions sometimes makes complication. So due to the severity attached with the health communication, it is very much crucial for an individual to have a basic competency and skills of media and information literacy with regards to accessing, understanding and participating in the health communication process. But rather than media perspectives, health-based literacy understanding of medical information is more prominent in the health campaign. The health literacy is one aspect and media and health literacy is other aspect. And health literacy is an established subtopic in the medical disciplines. Mainly the health literacy is concerned about what information is being disseminated, how people understand the information given to them. According to the WHO Health Promotion Glossary, health literacy is being defined as the development of the cognitive and social skills which determine the motivation and ability of individuals to gain access, to understand and to use information in a ways that promote and maintain good health. So, we will understand a little more about what are the stakeholders of health literacy part. Health literacy is not a standalone process confined within an individual. Rather, it is a complex process in which there are various stakeholders are involved, starting from the healthcare facilities, health professionals and government agencies, media entities, community organization and importantly general public. These are the main stakeholders of health literacy. With the limited resources available in the health sectors in the Indian context, avoiding a health crisis is a crucial step to preserve the health infrastructure for the needy persons. To achieve the rationalization of health infrastructure, individual members should maintain a healthy living conditions. That's what precisely the health literacy efforts are aimed towards, healthy living conditions in the social environment. Health professionals and government agencies are the main sources in which health infrastructure is being created. Media and communication system are the tools used effectively in order to reach a wider audience of the population. Community organization and community health workers are intermediary stakeholders who take care about the marginalized and disadvantaged sections of the society. These intermediary group like ASHA workers and Anganwadi community health workers carry forward the health messages from the government agencies and health professionals to the people who are normally don't have access to the main information resources. Individuals who have the better access to information are more likely to have access and understanding and participation in communication system, which results in a higher level of proficiency in the health literacy competencies. The multiple stakeholders and their role is very crucial, and the government and health professionals are the main pillars of the health communication process, and media plays a role of taking the information from the main pillars of health professionals or government agencies to the target group. And as you know, in the previous classes we had discussed about audience, media audience, how much space, how much time or how much access is being available in the social context. There are good number of people not in the process of media system. So media may take the information to the population, but it may not reach every one of the society, in every one of us, or every members of the society. So that's how the social and community health workers' role is coming into the picture. They will take the information from the reliable sources to the main target group. We were discussing about health literacy, now we are more focusing on media health literacy. This is a new concept and new framework that integrates the fields of literacy, healthy behavior and media. Media, health literacy and health communication are combined. That's a process, a complex process called media health literacy part. It's a new phenomena where because of individual can play a role in the ICT enabled platform. So that's why this media health literacy got a higher attention nowadays. This is a platform and the media health literacy is a platform for reliable empirical measures to assess cognitive, attitudinal and behavioral characteristic of individual or a group. Individuals have the capability to control the various social determinants that controls, that determines, that shapes an individual's ability to have the information related to the health conditions that are influencing his or her health through the thought and action. Unlike health content and information intentionally generated by the health system, mass media content is often is an implicit one and can be either health promoting or health compromising. Based on the non-beam model of health literacy, media health literacy is conceptualized as a continuum ranging from ability to identify health related content, explicit or implicit, in the media part, recognize its influence on health behavior, critically analyze the content and to express the intention to respond through action. Like health literacy, there are various stakeholders in order to reach a better health literacy level in the society. Media health literacy also based on various social determinants. The success, the ability of higher competency in the media health literacy based on various factors. Health literacy primarily revolves around the health infrastructure where information originates from the health department or health professionals or from the health campaign groups. Whereas the media health literacy revolves around the health information which is available in the public domain either through mainstream media or through digital and online platforms. The individual's competencies and the skills determine the utilization of health information. Various social determinants and constraints controls an individual's competency and skills. For example, age, gender, education, family, culture, socioeconomic status, culture, language and communication strategies are the main players that shapes the individuals or collective members' ability to have the information, understanding information and changing their behavior. The age, the gender and education and family part, that the socioeconomic factors, that plays a crucial role. We have already seen the disparities between the gender in accessing media and information in the earlier classes. Compared to male, female is not in an equal position in terms of accessing information, particularly the health information part. Age is directly related to an individual's health conditions, as well as higher in the age bracket, an individual tends to lack competency and skills due to lack of knowledge on new developments or inability to use those skills. Educational level of an individual works well if that person has a broad exposure and understanding. And the socioeconomic status and culture are some of the factors that influence the competencies and skills of an individual to access the health information. Even an individual overcomes these constraints, but fails to understand or fails to utilize the information of health issues if the communication strategies follow a wrong approach. We have seen the different aspects of health literacy, we have seen the different aspect of media health literacy, and primarily talking about from where the information originates and how a people or individual can access that part. But we will come to the last point how this the health communication operates in a complex social setup. There is a model is being developed in the US social scientist, it's called health belief model. The health belief model was developed in the early 1950s by the social scientists in the US Public Health Service Department in order to understand the failure of people to adapt disease prevention strategies or screening tests. The health belief model derives from psychological and behavioral theory with the foundation that these two components of health related behavior are the desire to avoid illness, the belief that a specific action will prevent or cure their illness. Basically, the two pillars of health model. The individual wants to avoid the illness or they want to recover from the illness. These are the two main aspects related to the health communication process. That's what that health belief model denotes that. These two basic concepts of health belief model, desire to avoid illness and belief to take action to prevent or cure are directly linked with the competencies and skills of media health literacy. Desire will motivate an individual to look for further information on that illness, and belief to take action that will motivate an individual to understand the information pertinent to that illness. However, the various social determinants that we have discussed earlier, like family conditions, age, education condition, and socioeconomic status, that plays a role in this process of that. Desire to accept some health intervention and ready to accept the treatment available for the health conditions. These are based on the individual's approach, psychological positivity towards the treatment, towards information, desire and a belief about health intervention, that shapes the success of any health campaign or living condition on individuals. Adequate training in the areas of media and health literacy will reduce the negative role of various social determinants and enhance the desirability and belief as proposed by the health belief model to take action that leads to healthy living conditions. Thank you.